Bore da pawb, morning everyone. Um, Thanks everyone for thanks for the opportunity to speak today, and for everyone for coming along as well. It'll be really useful to hear everyone's views and sort of give a little explainer of the policy and then our research and what we're trying to do for the Welsh Government and for patients then. So if we go to the first slide, I'll just give a quick introduction, uh, brief overview um, of what we'll be talking about today. So, as Claire was mentioning, in 2022 there was national guidance which advised that doctors and pharmacists provide longer repeat prescriptions beyond 28 days where this is appropriate for patients. You might have come across the change before by other words, such as extending periods of treatment, extending prescribing intervals, or 56-day prescribing. So Aranzu and I are from ICF. I'm from ICF, and Aranz is from the Behaviouralist, and we've been commissioned by the Welsh Government to carry out some research to understand how pharmacies, GP prescribers, and patients have experienced the change and been able to make it. We're independent research companies specializing in behavior change, and the focus of the research is to really dig into those sort of factors that influence what length of prescriptions patients are then given at the end. So in this session, we'll present the background to the policy and a bit about our research. And as Claire was mentioning, what we'd really like to hear is your thoughts and experiences of the change. And if you've come across extending periods of treatment for repeat prescriptions, and if you haven't, what your thoughts on it are, and what would help you to make to see the change come through in the future as well. So just a quick note about sort of the discussion, as Claire was mentioning. The presentation will be recorded, but the discussion itself won't be recorded then. Everything that we'll sort of have, we'll mention in the discussion, anything you say will be sort of used in our research in an anonymous fashion. So there's no worry about any personal information that could be used to identify you. And taking part as well is voluntary, so you don't need to answer anything that you don't wish to. And we've just linked the privacy notice with more information in the presentation, and we'll share everything afterwards as well. So to begin, I'll give a quick background to the policy as well. So in 2022, when this change came out, it recommended that patients are given longer repeat prescriptions where this is appropriate. Now, this followed a national review which found that it could release time for community pharmacies and practices if they were prescribing and dispensing prescriptions less often. Before this, the policy was for 28-day prescribing, in which doctors and pharmacies would provide most patients where it was appropriate for them with a month's supply of medication at a time. So making the change was expected to bring about quite a few benefits, not only to GP practices and community pharmacies by providing them more time to care for patients and to deliver those important clinical services, but also to ensure that patients have a supply of medicine for a period that's more appropriate to their needs. And that's the main consideration then in the decision. And then also to increase convenience for patients with less visits to the pharmacy and things like that as well. If we just move to the next slide. So the decision came alongside broader changes to pharmacy and primary care that I'm sure you might be aware of, such as the Common Ailment Scheme, so increasing the role of pharmacies in providing that first port of call care. New contracts for pharmacies and practices, which put a focus on delivering those clinical services. Digitization, which is introducing and improving electronic systems for prescriptions, and the NHS Wales app, as you'll be aware, and the batch prescriptions, increasing use of prescriptions where you can use them for up to 12 months. And then primary care clusters, those important sort of forums for collaboration between practices and pharmacies, and then other partners in the local area as well. So this kind of took into account the sort of broader changes in the primary care and pharmacy world, and tried to sort of give that flexibility. So under the guidance, GPs and community pharmacies have been advised to provide a supply of medicine for longer periods where it's safe and appropriate to do so. So the practices and the pharmacies will collaborate between themselves and with the patient, and doing so, they'll consider factors such as how much of the medication might be safe to give at one time, and thinking about the different types of medication and conditions, and also the patient themselves, how often the prescription may need to be changed, whether this is something long-term or is likely to be adapted in the short term as well, whether the patient needs regular checkups, monitoring, or help to take the medicine as well, and what other medicines a patient might be receiving. And the importance there is that their prescriptions are manageable and that they are sort of synchronized, so that they are getting the that benefit of convenience that the policy intends to give. So GP practices and pharmacies have all done this in different ways, and to different extents, really. So we've seen quite a lot of difference across the country and across different health boards. Some GP practices might have already been a bit further along in the process when the guidance came out, and then it's taken some longer than others to make those changes. And we know that this comes to do, is to do with different factors at the patient, pharmacy, and practice level, but also wider changes in the policy world as well. We'll just move to the next slide. So going back to our research, the Welsh Government has asked us to carry out this research, and the purpose really is to understand the factors that help or are barriers to extending periods of treatment in Wales. An important part of our research is that we're trying to understand what interventions and potential solutions could help to make this change and ensure that the benefits are seen by pharmacies, practices, and patients, and what support really could be provided to make that all happen. So the research so far has included a review of current evidence and data on prescribing intervals and those potential interventions that could help. We've interviewed local health boards to understand at that higher policy level what their experiences and understanding of the changes have been, and battling those different priorities that have happened over the last few years. Case study interviews then with a selection of GP practices and community pharmacies, where we've been speaking with different contractors across the country to understand sort of what their approach to the policy has been, what their awareness and understanding of it has been, and then those specific challenges or helpful factors that they've encountered as well. And we're also engaging with patients to hear their important perspectives and their experience of this, and using groups such as PAPIG has been really important for that. So since the guidance was announced, practices and pharmacies have introduced the changes more than others. We're interested in knowing sort of what different approaches have been taken, the reasons for them, and the Welsh Government can then sort of identify the different types of support that might be needed. And this is going to be a really important sort of understanding the patient perspective is really important for that. I'll just hand over to my colleague Aranthu, who's going to say a little bit about our research, looking at the patient experience, and then lead us into the discussion then as well.
Thank you. Yeah, so yes, Rian mentioned, so we are trying to understand the patient's experience around extending prescribing intervals, and how patients and carers have come across these changes, and your thoughts and experiences. So how these changes might look like in different ways. So for example, when you see a change in the amount of medication you receive in your prescription, or at your medication review, and like a GP asks how you will feel about having a longer prescription, or when you order or collect your medication and the community pharmacist might ask if you would like a longer prescription, or also when you start a new medication, a new repeat medication, and then it's set for a longer period of time. And below you can find a diagram, more or less trying to illustrate this process. So from when the doctor works with the patient and issues a new prescription, and then the patient requests the items in through different ways, like online, by post. But yeah, you may know this very well. And then the doctor and practice authorize the request, and then the prescription is sent to the nominated community pharmacy. And then finally, patient collects the medication. So it's trying to understand this whole process from your point of view, and how this change in prescription length might affect different stages of this process. So we have prepared a few questions, as Radian mentioned. In this, through these questions, we want to understand a bit about how you typically discuss repeat prescriptions with your doctor or pharmacist, if you have done so in the past. Your experiences with different aspects of managing your treatments, from requesting and collecting repeat prescriptions, and also how you feel about this change. So again, I think Radian already mentioned this, but this discussion is not recorded, but we will be taking notes. These notes will only be used for our own analysis purposes. So, and anything you shared won't be identifiable, you won't be identifiable in our reports, even if we use some of the comments you shared or points you shared today. And again, taking part in the discussion is voluntary. Of course, you don't need to answer the questions if you don't want to. So Radian mentioned the privacy notice. I think we will share that later. So if you have any questions, we can. If not, we can go to the questions we have prepared.